Ladies and gentlemen, we're here today to discuss a topic of great gravity. A number of years ago, I became aware of problems within our sport, within sport in general, that are significant and have a profound effect on people's lives. And that's the problem of concussive injury in sport. I was a player. I was fortunate enough to play at a fairly high level on a national championship team. And I can tell you, when I was a young fella, a tough defender, I got my head rattled quite a bit. The coach would come out on the field, kind of groggy, and he'd say, "Follow my finger." Yeah, follow your finger. Who's the president? Whoever the president was, Eisenhower. What's my name? What's your name? And if you answered it correctly, you were back on the field. There was no science. It was just voodoo. Because concussions are a hidden problem. You don't see the blood, but you do see the results. Now, today, we're not here to talk about any product. We're not here to do a commercial endorsement. We're here to simply raise the bar on our knowledge of concussions and what it means to people in real life. We have an incredible group of people here to be with us who have all been affected by severe concussive injury. And I'm going to introduce them. Each one of these people have been tremendous in giving to our game. So let me start by getting my pad to work. There we go. I'm really technologically advanced. Dumb and ignorant. We'll start with our ladies first. And I can tell you that introducing this young lady is an incredible joy for me, because while we were not on the field together, we were teammates. And very near and dear to my heart. Brianna Scurry is one of the most decorated and accomplished American soccer players ever. She was voted one of the best 11 players to ever play soccer in the United States. An incredible accomplishment. Brianna was the U.S. team's goalkeeper from 1994 to 2008. Brianna played 173 matches wearing the crest of the United States of America. The most for any goalkeeper in our history. She anchored a back line that produced incredible teams that I'm sure you all know of. Bookended at the beginning of a career by an Olympic gold medal in 1996 in Atlanta. And I remember that party.
That was a great time, wasn't it?
Oh my God. And then by winning the FIFA World Cup in 1999, many of you must remember her goal saving in that tournament. She's an unbelievable spokesman and an ambassador, and has suffered a significant, serious concussive injury, and is here to tell us about the effect of that. Dr. Tom Kaminski. Dr. Tom? Dr. Tom Kaminski is the professor of kinesiology and applied physiology, as well as the director of athletic trainers at the University of Delaware. The main focus of his research is on sports-related concussion, but more specifically, the effects of hitting a soccer ball, and including young women. Dr. Kaminski is a world-leading researcher in his field and considered one of the foremost authorities on women's soccer heading the ball. He received his PhD from the University of Virginia in 1995. Please welcome Dr. Kaminski. Aleko Eskandarian was the MLS #1 overall draft pick in 2003. Prior to playing as a professional, he played for 3 years at the University of Virginia, where he was named the best player in college soccer by winning the Herman Trophy. In 2002, he won it in 2002. Aleko was considered one of the rising stars of U.S. soccer, when his career was cut short by concussive-related injury. Next on our panel is Steve Sampson, one of the most accomplished and decorated soccer coaches in the history of U.S. soccer, having achieved, listen to this, championships at the professional level, at the Division I collegiate level, at the junior college level, and at the high school level. He is only one of 3 coaches in the United States who have won the MLS Cup and the Open Cup, U.S. Open Cup, in the same year, which he did in 2005, while he was the head coach of the Los Angeles Galaxy. He is also one of only 2 American coaches to coach 2 national teams. He coached the United States of America in the France World Cup, and he coached Costa Rica. Steve, welcome.
Thank you.
Next on our panel is Ross Paul. Ross is a graduate of Creighton University, 3-time All-American. In 2012, he was inducted into the Hall of Fame. 9 years as an MLS player, Colorado Rapids team MVP, 2-time MLS All-Star. 1998 to 2003, he was in the pool of our national team players, and his career was cut short by traumatic brain injury. This is a problem that now we speak about in our press. We know that American football is replete with the problems. We are concerned of the effect of this kind of injury and what it does to young people and to professional people as they play our beautiful game. So what I'll ask everyone to do at this time is to give a brief statement about their situation, perhaps a highlight of their career, and to talk about concussive injury and what it's meant to them at the highest level. And you're looking at just a small sample. Taylor Twileman of New England Revolution and the U.S. national team wanted to be here with us today, but had duties announcing with ESPN. Another person whose career was ended abruptly by head injury. Magnify this problem by the number of youth players that we have playing in the United States today. And damn it, if we don't pay attention to this, we are all negligent. This is something that we must address. It's imperative. So first, I'd like to start with Brianna. Brianna, welcome.
Thank you. Thanks for having me, everyone. Well, it's an honor for me to be here and to be able to talk about not only the beautiful game that I love so much, that's given me so much, and has given me a life that I could barely dream of, but it's been absolutely amazing. And it's great to be here now and to talk about not only the beautiful game in my great career, but also an issue that is prevalent in our sport that is not necessarily understood, but is so very important, like Hank was saying. Concussions in our game. It wasn't until recently that I realized that 1 out of every 2 female soccer players will have a concussion. Most of the time, 85% of the time, they end up, like Hank was mentioning, you get your bell rung and coach asks you where you are and what day is it, and you take a few days off and you get back in there. But there's that 15% that unfortunately several of us up here on this panel right now are part of that 15%, where things just don't get better, they get worse. And in my particular case, I had a fantastic career from 1994 all the way up through into 2008 for the national team, and 2010 for my club team, the Washington Freedom. And I enjoyed every minute of playing. It was a great honor for me to wear the crest and represent my country, to be able to do and play the sport I loved for a living, and to be so fortunate to be a part of a group of women that were not only passionate, but they were fun, and while we were doing it, incredibly successful as well. I mean, Olympic gold medals, World Cup championships, clearly by far the highlight of my career. And during that time, I was very fortunate. I was lucky. Most of the time, I'd get in a situation in the goal where a sure collision would ensue, and I was able to avoid it. get in there, get the ball, get out, right, as a goalkeeper, and you dive and don't hit the post with your head and dive forward and all these different things that I learned and I did so incredibly well. I had a couple of concussions, when I played for U.S. Soccer, but most of the time, no big deal. Got my bell rung. Abby fell on my head, which I'm sure you can imagine was a bit of a situation for me and for her. But I recovered just fine until the one hit in a game with the Washington Freedom in 2012, April 2010, excuse me. Memory loss is part of my issue, so you have to give me a pass on that. On April 25th, 2010, playing for the Washington Freedom in a game against Philadelphia. I was in the game, a low ball was shot from my left coming in. I go out to get it, and I remember that shot from Lori Lindsay, of all people. I'm sure a lot of you know who that is. Routine ball, coming out to get it, low ball, and one of their forwards comes across the right side. I never even saw her. I got my head down in there. She hits me on the side of my head with her knee. Changed my life forever and ended my soccer career right there. It wasn't exactly the way I wanted to go out. I haven't played since. That was nearly 4 years ago. As wonderful as my career was, and as storied as it was, and as many people that I was so fortunate to inspire through the passion and the way I played my game, my number one goal now that I've retired from the game, is to help people like Hank and this fantastic panel bring more awareness to the seriousness of concussions. And I'm not trying to scare anyone, but I guarantee you, one hit can change your life forever. And it's important that people understand how serious the problem is, but that there is hope. And I've gone through a heck of a time the last several years dealing with this, the emotional part of it, the physical symptoms, memory loss, an inability to remember, to balance myself. And as Hank said, in that 1999 World Cup, that fantastic save I made sometimes seems like a distant memory. And the only thing that keeps me going sometimes is I know that I'm capable of having that kind of focus and concentration, although now it sometimes seems that that wasn't me. But I know it was me. And so I'm here today, not only to talk about the beautiful game, but to give people hope and light that if you go down and you're not feeling well, and concussion is the problem, but there is a solution, and we all need to pull together to raise the awareness and to find it. And I hope to be someone who, whenever I come out here and speak, at least you learn something and take something away that is meaningful and that can help you and your clubs and to protect the young youth players of today. So thank you.
Thanks very much, Brianna. Ladies and gentlemen, there's no doubt you can see why the women's team was so successful. Such a heartfelt and articulate statement from someone. And Brianna, you need to know this, that save, anyone who's an American soccer person, that save will live in our heart forever.
Thank you.
So, well done. Aleko Eskandarian, tell us about yourself, big guy.
I'll be pretty brief. I don't think I can do any justice following that up. First of all, I have to say I'm pretty uncomfortable talking about my own experiences with concussions. I give Brianna a lot of credit for speaking so candidly about it and hoping to make a difference. I was in a dark place when my career ended, and I don't like to revisit it. Probably in the last year or so, I've become a bit more active in talking about it and trying to help people as much as I can. And to be honest, not a month goes by that I'm not getting phone calls either from current MLS players or national team players or concerned parents or whatever it is, just calling me asking for advice. And I do it because, I don't want anyone to go through what I had to go through. In regards to, my background, my career, I know Hank touched on it. I played in MLS for 8 years. And actually, I was just talking about it earlier, my professional debut with DC United, I got a concussion, which I would love to tell you about, but I don't remember. I had, I believe, amnesia for about 6 hours. And, speaking about how much this injury has come into focus, I stayed in the game. And I don't know what happened. Obviously, a trainer came out, asked me some questions. I don't know what I said, but obviously it was enough to stay in the game. And it wasn't until actually Carlos Bocanegra, who was playing for the Chicago Fire at the time, grabbed me and was like, "Man, you're not right." And he was on the other team, and he was just concerned for me. And, might have even saved my life because another collision, and who knows what would have happened. But Bocanegra made me sit down on the field, and I came off, but I was back at it a week later. And finally my career ended in 2009, playing against AC Milan, and just routine play. Eddie Lewis, a teammate of mine with the Galaxy, swung in a perfect cross like he normally does, went just over my head, and Thiago Silva, who's now a center back for PSG, was on the far side and cleared it, volley first time, right into my face, broke my nose, gave me another concussion, and that was it. So it's been a tough road since then. I was 26 at the time. Felt like I was in the prime of my career. I scored 2 games in a row, going into that friendly match. So felt really good about where I was at as a player. And just like that, the thing that I loved most in the world was taken away from me. So it was very tough to deal with. And I'd say for a good year and a half, I was a vegetable. I was in a dark place. I didn't want to speak to anyone. Family, friends, I shut everyone out, and it was definitely a struggle. But eventually, I turned a corner where I decided to stop feeling sorry for myself and to just focus on the things that I could do. So I decided to go back to school and finish my degree at the University of Virginia. Got into coaching, and now I'm with the New York Cosmos as an assistant coach. So as much as I'll speak here to help the cause. For my own mental health, I prefer to focus on the things that I can do and keep all negative thoughts out of my head. But when Hank asks you for a favor, you have to come through. So that's why I'm here.
Thanks, Alex. Thanks very much. Ross, tell us about yourself and what's happened.
Well, I was one of the first Major League Soccer players to have to retire from concussions. Followed by me was Taylor. But from the beginning, first of all, listening to them speak, it just brings back, it's been a long time for me. It seems like, I don't even know how long it's been, but it seems like a long time, like that memory that you can't, it's like, what did that really happen? But I've loved soccer from the very beginning of my life, and I was driven. These guys are driven. You can hear it, and they're going to continue to succeed because they have that. And the thing is when you're driven and you have that, you want to succeed, and you finally do succeed, the higher level that you get to, if I'm trying to go a different angle than them, if you sit out of a game, then that gives somebody else an opportunity to take your position. That's at the highest level, and at the youth level, it's just you want to be on the field. Now, coming with when playing a game of any sport, you're going to have injuries, and I can remember some harsh injuries I had. Not from my ankle. I got traded from the Colorado Rapids to New York, and right before the trade, I got hammered in the ankle and could barely walk. But in my head, I had to go to New York and step on the field. So what I did, I went to the doctor and I did all I could to say, what can you do to help me get on the field? And, cortisone shot, so you get a cortisone shot. And hopefully that helped. And who knows what damage I was doing to my ankle at that time. But not more than a year later, we went down to to a game in Tampa, and I went up for a header. The ball was coming in from a goal kick, and I was going backwards, and it went right over my head, and Richie Kochow came from behind and hit me with his shoulder. Didn't mean to, just coming in, part of the game. Out of it, on the ground, and straight, the next thing I remember, I was in the ambulance, strapped down, freaking out, didn't know where I was. Remember opening my eyes, yelling at them, saying, "Let me out of here. I don't know what's going on." Went out of it again. I don't know if they gave me a shot or something to make me stop. But next thing I remember, going into my hotel, don't know how I got to the hotel. Nobody from my team was with me. I walk into the hotel, and I see my team there, and coming in with, just a fractured cheekbone, can't feel the side of my face, and I remember somebody said, "So when can you play again?" So, I don't know. I don't know. I don't know. But went back, got testing, and recovered, supposedly. Just like a cortisone shot. I said, well, what can I do to get back on the field? And so I had a headache. I was dizzy and didn't know what to do. I took Tylenol and went back on the field after about 2 weeks, and that was just because I finally felt like I could be stable. And so I recovered from it. I thought I did. And 4 years later, after I got traded to Columbus, I ended up getting hit in the head in a preseason match, and it wasn't near like that. It was going up and just to a header and getting hit in the side of the head, and went off the field. I was dizzy. Went off the field and came, and again, they asked me questions. I have no idea what they asked, but is the stadium yellow? I was like, sure, it's yellow. No, I don't know what they asked, honestly. But went back out on the field, got hit again, and I played normal, but then again, I got hit in the head again, and did not feel normal at all after that. And I was afraid. I was afraid to say something because I didn't want to get off the field. There was no science to test it. You get an MRI, but the MRI doesn't show most of the time. It could show, but it didn't show anything on me. And so I got back out on the field, and again, long process. I didn't feel okay for a while, but I still played. Got hit again later in the year, and it wasn't a hard hit again. And that was at the very end of the season. Our season ended, and then they started getting kind of serious because I started saying more because I didn't feel right. And I went to doctors all over the United States, and some doctors, it was all different everywhere I went. Every doctor had a different opinion. And my mentality was, I got to play. I have a family to support. And I wanted to get on the field, and I loved playing the game. I had so many unbelievable experiences playing the game of soccer. So coming to the end of my career, when I'm in the national team, in the national pool, at the top of my career, just got named MVP of the Columbus Crew, and we went through an unbelievable season where we had a special team. We didn't win the championship, but it was just one of the most special years I had with a group of guys. And the next preseason, I went out there and I got it. All I did was go up for a header, headed the ball. It was a long header, and I just barely got hit from behind. Didn't even get hit in the head, and I just landed and didn't know what was going on, but I was not right. Walked off the field myself. And said, something's wrong, and something's really wrong, and I got to get tested. And finally I got sent to a lot of doctors, and none of them, some of them said, you got a serious issue. because they would do testing on me, and my testing for memory is bad, very bad. But had to finish. I had to quit playing finally when the doctor said, "You will never step on the field again." And I'm just happy to be here because it needs to be talked about. There needs to be science behind it because there's lots of kids out there. It's all about awareness to me, and that's what I want to do is make youth coaches aware of the issue and how serious it is, because 9 years later, I'm still taking medicine. I still have double vision in my left eye. Still can't remember things. And it's not a life you want to live.
Well, we've just heard from three of the classiest and certainly three of the best athletes ever to wear a United States national team jersey, and what this problem of concussions can do to the human soul and to the human spirit. Now I'd like to call upon Steve to talk to us about, from a high-level coaching perspective, he's coached international, coached literally in the World Cup, and coaches youth players now. Steve, can you talk a little bit about your impressions on this issue and the need to focus on it?
Thanks, Hank. Yeah, I don't know if all of you are feeling the same thing I'm feeling, but I've never had a concussion, never experienced that. But I think every coach across the country needs to hear these kinds of testimonies, because I don't think we really understand the gravity of and the seriousness of this injury, and not just in the moment, but how it impacts lives for a long time, if not for the rest of their lives. So I would like to speak from a perspective of a coach, a professional coach, and I was always blessed, whether it be at a collegiate level or at the professional level or at the international level, to have trainers and doctors alongside of me in training and in games, to where if something were to happen, I'd send the trainer onto the field and all right, you go make the diagnosis, you're the expert, and then come back to me and tell me whether or not this player should continue or not. But all of you need to know that there's an enormous amount of pressure that is placed on those trainers and those doctors. Now, they're all trained and they're all professionals, but can you imagine, for example, a player that gets injured during a qualification period and knows that if he or she is out of camp or out of the national team for a while, what pressure would come to bear on that trainer and on that doctor to help them get released, to get back into competition. I can't tell you how many times I've had private conversations with players where they've come in and told me that I'm ready to play, and I've said, no, the protocol is that the doctor must release you, and that's just the way it is. The good thing about that is that takes the pressure off the player, that takes the pressure off the coach, and it leaves it to the experts. The unfortunate part about this is that at the collegiate level and at the professional level, international level, that's makes up maybe less than 1% of soccer here in the United States. And at the youth level, and now I'm the executive director and technical director of a club out in California. We have 50 teams and coaches and parents and players, and we just don't have those trainers and those doctors available on a daily basis. And so what's happening is that two kids will go up and they'll collide heads during a training or during a game, and our coaches don't have the resources or the experience or the background with which to make a decision as to whether that player should stay on the field or not. Typically, if it's a bad collision, they'll bring them off the field, and if it's in the first half, then maybe the player convinces them that they're okay and they can go back in the second half. And too often we allow that player to go back onto the field. And then, and I've experienced this firsthand, where that kid is allowed to go back onto the field and they incur another injury. It might not be in the same game, might be in the next week. But then all of a sudden, that something that could have been prevented if we had the education with which to teach our coaches of what to look for and the risks involved with this, you know, to take a very, very, very conservative approach that when our young players collide or have a series of situations where they've headed the ball and they've come off with a headache, that we just don't put winning ahead of health. And so those individuals have to be told to go see a doctor, and that they're not going to come back to training and they're not going to come back to competition until a doctor has released them. There's an enormous amount of pressure on these kids. We have one U15 national pool player, an exceptional young lady that had 4 concussions in a period of 6 months, and went to UCLA Medical Center. They couldn't discover exactly what the issue was. Finally, they just said, "We can't diagnose this. You have to stay out." They finally went and saw other experts, and this young lady was diagnosed with severe brain trauma, and she was probably had this severe brain trauma while she was competing and playing over those 6 months. Stayed out 8 months, and at the period of 8 months was told to stay out a year, but at the 8-month period she goes to her mother and says, "I've been invited into the ODP, can I please go?" And the mother says, "Maybe, let me talk to the doctors." She calls the doctors, tries to put pressure on the doctors. Doctors say no. Right thing to do, right? 2 months later, same thing. Invited into national camp. "Mom, I'm giving up an opportunity to go participate with the national team. All my fellow teammates, they're bypassing me. Can I please go?" Mother goes back to the doctor, and the doctor says, "Well, okay, it's been 11 months. All right, we'll release you." 1 month later, she incurs another concussion. So now she's out for 2 years. So what's my point in all this? My point is that there has to be a debate across this country. There has to be a discussion, at what age do we teach heading? There has to be a discussion with greater emphasis for all of our coaches on the proper technique of heading. There has to be technology introduced such that we can measure these types of incidences on the field, whether it be in training and in games. And there has to be a method by which we don't take risk and don't put our athletes in undue risk. The pressure from parents to force the coach to put the player in to win, to gain exposure, the pressure from the player towards the coach, and the pressure of the coach to win are taking precedent over a player's health, and it happens over and over and over again. I would imagine that these 3 individuals here, at some point, whether it be a head injury or some other type of injury, right, wanted to get back on the field before they were physically ready to get back on the field. Whether it's to support a family, whether it's the fear of losing their spot on the team. And I think the debate is phenomenal. I'm really happy to be a part of the discussion, and I hope to be a part of the discussion going further. But as you can see with these 3 individuals, this is a real issue, and it's something that we have to address. Thank you.
Steve, thanks very much. Thank you. And certainly it's my hope that part of the discussion, yes, but we all need to be part of the solution. Yeah. These are not casualties of war. These are people with severe traumatic head injury that maybe not be preventable, but certainly diagnosed and then perhaps treated well. Doctor, we know that if we break our knee and break our leg, we can get a new one. We know if we break our head, we may not be able to do that. I wonder if you could shed some light for us today on the hard science and measurement and what your recommendations are for the difficulties that these young people have faced.
Yeah, you know, it's remarkable certainly to be up on this panel, and I can attest to the fact that these are real stories. And as a certified athletic trainer myself, I know that the way that we've treated concussions over the last 30 years of my career is much different. So to hear Ross talk about the early days, I mean, that's real, because that's what we had. That was our knowledge base at that time. That knowledge base has changed tremendously. And a lot of my colleagues throughout the United States and the world that are doing concussion research, it's really a testament to them. So the standards at which we treat athletes today is much different than it was years ago. It's unfortunate that these athletes, when they play the game, they take a risk, and that risk is injury, and concussion is part of that. And fortunately now, because of the media attention in the United States especially, it's not as grand in the world, but there's brought that focus on people who are on the front lines, such as certified athletic trainers, physicians who deal with these. And I can tell you that we really have been advocating for a much more conservative approach now in dealing with these concussions. And I think that that's a good thing. Unfortunately, they have to suffer those consequences because perhaps along the way they may not have been treated the right way. But again, I'll sit up here today and advocate for certified athletic trainers. I think that that's key. I'm an educator myself. I know what my students, I know what the training that my students get. And so that's a good first step. And that might not always be a resource available to you, but that's certainly a good first step. Coach Sampson talked about the fact of educating coaches. Well, in those situations where there's not a certified athletic trainer, coaches are on the front lines. Coaches, referees, parents, they're closest to the student athletes that get hurt. And just drawing attention to it. So the advocates here, that's important because it's going to draw attention to the fact that these athletes need to be seen. We are much more conservative with concussions today than we were, you know, just 5 years ago. And that's a good thing as we move forward. In terms of my own research, I've been doing this for about 18 years in terms of the concussion research in soccer. It goes back to my days at the University of Florida and worked with the women's soccer team. Had a fortunate opportunity there to work with Abby and to work with Heather Mitz, who are on the national team. And that work's continued today in terms of some of the work that we do with heading. We actually track headers at every practice, every game at the University of Delaware. And we have data from our student athletes from the beginning of the year to the end of the year to the end of their career. And I can tell you today that despite what the media might say, heading the soccer ball, if done correctly, is not the problem. It's not the problem. The act of heading does produce concussions. These guys are living proof of the fact that, you know, sometimes you go up to head a ball and you get hit with an elbow, get hit with another head. But the act of heading traditionally has not caused those concussions. There will be athletes running down the field. They get hit with an errant ball, go off their head, they produce a concussion because they weren't expecting it. So, you know, I think that's a good thing, you know, to protect the sport, because heading is such an important, integral part of the sport is a good thing. And our data points to the fact that we're not seeing detriment there, and that's a good thing. But concussions do occur due to the act of heading, without question. And as Coach Sampson said, too, you know, I'm an advocate that young kids don't need to be heading the soccer ball. You know, I think that maybe 12, 13, 14, when their neck muscles get strong enough, then they can begin to head the ball. But let's face it, even in the young kids' game, the ball's not in the air that much. It really begins to get in the air a lot, you know, 14, 15 years old. And unfortunately, the concussions occur because, again, that's a risk that you take playing the sport. But the concussions aren't occurring specifically by you going and heading the ball. At least our short-term data shows that. I can't speak to the fact of what happens to these student athletes when they're 20 years after they've given up their career. Only time will tell to see what's happened. I venture to guess that it's a little bit different than what you're seeing with football because the forces are much greater. But again, I can't say that with any exact proof because we're just not at that point. But research is evolving, and we will get better. Just like we've gotten better the way we treat, we're understanding what's happening in the sport and then with the skill of soccer heading as well. So,
Doc, thanks very much.
you got it.
Thank you. You know, 20 years ago, as a young athlete, well, 40 years ago as a young athlete, never wore a heart monitor. I don't work out without ever having a heart monitor, which measures where my heart rate is. I see the day where we changed the paradigm of knowledge that we were a head monitor. And my feeling is that that's so important. We'd like to entertain questions. And if we can do that, I'm a 60-year-old guy who doesn't know Twitter from whatever. So if you can come up and draw down the questions for me. And from the audience, yes, young lady.
I coach at a collegiate program, and we have baseline testing in place for our athletic training department for our athletes. I think it's a great evolution of that preparation. But I've started to notice a trend, and you even see it in the professional ranks, of people wearing these headgear. You see a better jacket first, and everybody knows that it's gold first. But lots of kids are starting to wear them. I find that when I'm recruiting, a lot of parents have their kids wearing them because they think that they're going to just prevent concussions, and so the kids are now becoming reckless in terms of the way that they approach the game because they think that they're protected. Do you guys, any of you, have any thoughts on whether or not those
Can you all hear that question? No.
Yeah, the question's related to the headgear that's available and the concern, and you know, we've looked into this. They've certainly become much more popular today. There's no real good evidence out there that shows that they actually protect or prevent against concussions. Perhaps they give some type of a psychological benefit, maybe. You know, you look back to football helmets. When they put the face mask on football helmets, there was a rise in the number of concussions because now the athletes felt, well, I'm invincible. I've got this. My face is protected. And that's the concern that I have, just what you voiced, is that, you know, here's an athlete now wearing this headgear, so maybe that makes them a little bit more aggressive as they approach the ball or aggressive versus their opponent or whatever. But to date, there's no real conclusive evidence that points one way or the other that these things are effective in preventing concussions. So,
We have a Twitter question. Should teams on every level of the game provide counseling resources for players forced to retire prematurely because of concussion? Anybody want to take that one?
Brianna,
Counseling.
how about you?
I'll take that question. One of the things that I think that I've found most interesting, now that I've quote-unquote come out with my situation with my concussion, is I get so many Facebook messages and emails from parents and players that haven't been able to return to playing, who are considering not playing anymore, or who have been forced to stop playing. And I think it's monumentally important that we all understand the emotional impact that having a concussion can have on you. And I think that's where the counseling might come in handy, to have some sort of uniform protocol about the concussion and preventing. I understand that, but for me, one of the biggest pieces of the issue that I had and still continue to have is that emotional piece of it. And that's the part, that's the dark place that the guys were talking about. That's the dark place that I was in, and that's the dark place that people don't like to talk about. That's the part that makes everybody uncomfortable in their chairs when they discuss concussions. And I feel that if you have counseling in place, I don't know how you would even begin to provide that for clubs and teams and organizations, but it's hugely important, because if a decision has to be made that a player needs to retire, it's the emotional side of it, in order to understand how they feel, to understand their emotions about it, the depression, the anxiety, the panic attacks that happen afterwards. that needs to be addressed, and I think counseling would definitely help that, because that's the piece that no one talks about that could be the most detrimental in the long term. And I think it's something that is very important to me to point out and make people aware of.
Great. Ken?
I'd like to know, when, as a group and as the NSCAA grows, there are still numerous high schools and even middle schools across the country, plus soccer clubs, who do not have a trainer at the sidelines for games and almost never for practices. As a referee and as a coach, I have seen this, including high school playoff games, no trainer present. How can the NSCAA become a more effective lobbying group to go to state high school associations and make it mandatory that school district budgets are increased for athletic trainers? I think that is a very serious step.
Well, it's a very good point, Ken, and I might think that there are two guys here that can answer that. As a member of the NATA and in my former career as the Vice President of Marketing for Gatorade, we supported the NATA in their quest to have athletic trainers everywhere. I think the right person here is either the Doc or Steve.
Yeah, again, I think it starts with parents. Parents need to push, and budgets are tight, but I liken this in the small state of Delaware. We're fortunate, all 56 high schools. 56 high schools. That's not too many high schools if you think about it. California probably has 5,600. I have no idea, but they all have a school nurse. So the school nurse is there to take care of the kids from 7:30 in the morning till 2:30 in the afternoon. Well, let's have that same insurance policy when the student athletes set foot on the fields from 2:30 to 8:30 in the evening. And so it just makes sense. It really does make sense. I think we've come a long way. Our profession's come a long way. We've been able to partner with outreach programs where athletic trainers work in the morning, perhaps at a clinic, outreach to a high school in the afternoons. That's a good thing, and that's a good first step. But you're absolutely right, sir. We need more. We need more of those athletic trainers on the front lines to take the burden off of the coaches. As Coach Sampson said, he had that luxury, and all the time that he's coached, he's had that luxury of having the athletic trainer. But some of you know that you might not have the luxury of having that person on the sideline, and that's very difficult because the athletes, they demand that. They demand to have a person who's qualified to be able to handle those injuries.
Well, are there enough athletic trainers to do that in the country?
Yeah, there really are. I mean, and that's, there's 360 schools across the United States that actually have accredited athletic training education programs. At UD, we put out about between 16 and 20 students a year into the workforce. And so, absolutely. I think it can be done. But again, I think that in that absence, we just need to continue to educate our coaches. And, when in doubt, err on the side of being conservative.
Here's a tweet, and we'll get back to the audience, but we have to take care of the internet as well. Here's a tweet. What can we do to help prevent concussions before they can happen? Ladies and gentlemen, anyone want to field that one?
Well, I aside from having professionals on site, I think the realistic approach for the youth level is the proper education of our coaches. And give them the tools and the resources with which to make good decisions, and to really encourage them to take an incredibly conservative approach to whenever someone has a head injury. I think that has to come from the top down. I would love to see the NSCAA, I would love to see the Federation come out with a statement, a joint statement in support of this. And we all realize the economic impact of having trainers available for all of our matches, but somehow American football at the high school level manages to get it done, so I think we can get it done at all the other sports. basketball always has either a trainer or a doctor available during their games. So again, I think we can do it for soccer. And you guys would know this, probably one of the most powerful groups in the country is the Players Union.
No.
Right? Yes. And so if the Players Union really takes a stand on this and gets the support of whether it's the national team players and their collective bargaining with the federation or the MLS and the Players Union with the MLS, they can come out with a strong statement in support of this.
One more question from the floor. Oh, we have a lot of questions from the floor. Dr. Contaguglia.
First of all, I want to let people know that the landscape here is changing very dramatically.
Can you hear Dr. Contaguglia?
All 50 states now have passed legislation requiring coaches to be trained to identify concussions and when to take players out. It varies regarding high schools versus clubs. But Congress is currently considering legislation for the whole United States in this area. So, it's an education piece. As a coach, I take the CDC course online, and I'm required to get a certificate before I can step on the field. So all of these things are going on, and the landscape is changing rather dramatically. But I have a question for the athletes, and that is, knowing where you are today, would you still have played the game?
Great question.
Absolutely, unequivocally, yes. I think for my situation, the part I'm most grateful for is that I got my big hit at 38 and not 18 or 28. I thank my lucky stars for that every day. But knowing what I know now, and if I had the awareness that I was going to go through the absolute hell I've been through the last nearly 4 years of my life, I would not trade it. And I think that's the important part. It's not about not playing. That's not what I'm advocating by any means. I'm advocating education and understanding and awareness. And I would do it again and twice on Sunday.
Ditto.
Short-term memory.
100% yes, I would play, and don't regret playing at all. I mean, it's such a blessing to be able to play at that level for so long, and not doing this to make anybody feel sorry for any of us by any means. It's all about where it's coming to now, which is exciting. I mean, when I went through it, it's very different now. And if we were at this place now when I was playing, I'd probably still be playing. I mean, I really think it's going in a great direction, and that's why having a panel like this at the point we're at right now, it's going in the right direction, and we're not there yet, and who knows if we'll ever get there. But soccer is a beautiful game, and it is a unbelievable sport for the kids to play, for everybody to be involved in and to watch, and to change it. I don't think you can change the game. You can just become aware of injuries, and this is an injury to your head, so it's a little bit more serious than your ankle. So
we have very limited time left. We've talked about some things of incredible gravity. I think it may be nice for you perhaps to hear from these unbelievable people a highlight of their career. So I'm going to ask a question. If you had to pick a highlight of your career, what was it? Ditto.
Yeah. I really can't say one thing. It's about the whole experience. My highlight is the people I've met because of the game. I mean, and the long-term relationships that the game has brought me. So one memory, can't really say. Sorry.
Ditto.
Ditto. Yeah, no, I do agree though. Obviously there are great moments on different scales between, being MLS Cup MVP in a championship game or scoring against Real Madrid. I mean, these are memories that I'll carry with me for the rest of my life and hopefully tell my grandkids about. But I think in terms of the best part of it all is just the feeling that I got stepping onto a field. Being able to share those moments with teammates, but more so than anything, just the life lessons you learn through the game. I think that's been the most rewarding part of it all is being able to grow as a person and as a man, and earning up to things, responsibility, all the valuable life lessons that come through it. I'll always have gratitude for the game for that.
Can I have 3?
Yes.
All right. My first is one of the most obvious, which was making that huge save in the 1999 World Cup in front of 90,000 screaming USA fans at the Rose Bowl. That was an amazing experience for me. The second, and not least, but second to describe, was stepping on the podium in 2004 after we won Olympic gold again, and nobody thought we could except for the 20 people on that team. Articles written about, the fun bus has got flat tires now, they're old, they can't get back up there, they can't do this again, but guess what? Yes, we can, and we did. And overall, for me, the most amazing thing has been the incredible positive impact that my teams have had on not only the U.S. and in soccer in this country, but in the world. And for every child that had a dream, and every woman that wanted to play, and every young girl that we gave them another choice, and we gave them hope and possibility. And I think for me, now that I'm on the north side of 42, that is one of the most amazing things, to know that I and my teammates inspired millions through just playing our passion and just doing what was most important to us. So for me, that is one of the most amazing things that have come of it.
Thank you. Steve?
Difficult. I've lived the highs of highs and the lows of lows, but I wouldn't trade it for anything in the world. Winning a national championship at Santa Clara University, going 20-0-3, but it was more than just winning the championship. It was the truly remarkable chemistry of that team and the number of players on that team that are now coaching, directing, and our administrators at the highest levels across this country. Certainly being named the national team coach of your country is, I think, the greatest honor for any coach. Beating Brazil, 1-0 in '98. Beating Argentina 150 miles from the Argentinian border in Uruguay and Paysandú, beating them 3-0. In Azteca in front of 120,000 people with 10 men for 60 minutes, tying Mexico, the first time we ever got a point ever in the history between the two countries. And in the last 10 minutes of the game, every pass that the U.S. made, 120,000 Mexicans went, ole, ole. In part because they were upset at their own team, but also respectful to the United States, and then a standing ovation to the U.S. team as we walked off that field. And it really was the turning point for us to qualify for the '98 World Cup. Literally, I could go on and on and on, but I've been truly, truly blessed with great athletes. Certainly, all of us who are coaches know that we can accomplish nothing without great athletes and great support of it, great administrations, and getting to know guys like Hank Steinbrecher and Doug Hamilton. The incredible experience I had at the LA Galaxy winning the double that year in 2005. I would never have been able to do it without the great players, but also without the incredible leadership and cooperation of Doug Hamilton, who passed away in early 2006. So, gosh, I could go on, but I've just been incredibly, incredibly blessed, and I thank God that I've had this opportunity.
Thanks, Steve.
Yep.
Well, ladies and gentlemen, our media is replete with stories of concussions in sport today. We hear about $780 million settlements. We hear the news about NFL football players sending their brains to Boston. We hear all of these things. The solution is within us. We are a different culture than the NFL. We are a different people. What makes us different is the universality of our game and the knowledge that we can change anything when we put our mind to it. This is a very significant problem, and the solution is to us, and we have to find out what's right for soccer and these injuries. I try to end any presentation I give by imploring the people in the audience, all soccer people, to don't think about the beautiful game. Think about what makes the game beautiful. And I'll tell you, this is what does. The solution is ours. Join me in thanking them all for sharing their stories. God bless you all. Thank you.